Marhaban, this is Dr. Rich. For a while, I've not been creating my usual videos because I was trying to get myself. I was not sick. I lost my father and it was a terrible moment for me. So I just took some time off to get myself. But while I was consoling myself, I'm still very down. I do get a lot of questions from people asking about how they can come to Saudi Arabia or how the processes work. Different healthcare professionals have been getting a lot of questions on my DM, and I just want to make another video. I know I've made so many videos on this, but I just want to make an updated video so that those that are coming new to the channel can also watch and know how to do those things. I've done a lot of videos on this, but I just want to do a new video so that it can help them to understand some of the things I was trying to explain to them. Okay, if you want to work in the Kingdom of Saudi Arabia as a healthcare practitioner, whether you're a doctor, a nurse, pharmacist, lab scientist, optometrist, any allied health services you are under, you can actually work in the Kingdom of Saudi Arabia using the same process. Okay, first you need to actually know if your services or your profession is readily needed here, because there are some professions that they can easily cover or recruit using their local doctors or their local professionals here, while some the local professionals cannot cover that sector, so they need to get doctors from overseas. So, but you need to know if your profession is readily needed, if they are employing or recruiting from outside the kingdom. So, if your profession is actually recruited outside the kingdom, the first step you need to do if you really want to come here is to start by verifying your documents. Okay, you need to verify your documents using DataFlow group. So DataFlow is an organization that organizes a verification process for you for the Saudi Commission of Health Specialty. So most of the GCC countries, the health ministry uses this organization to verify their documents, the documents of their prospective employees. So you need to get for data flow verification, you need to get your education documents, your license documents, and your employment documents. For the education documents, you will need your degree certificate or your diploma certificate. You will also need, for your license document, you will need your license, your practice license in your home country. For experience documents, you will need a letter of employment from your previous employer stating your work, that's your profession, and stating how many years you've worked with them. Okay, so these are the three group of documents that you'll be needing to verify with DataFlow. So after you've done this verification, it usually take up to a month to 40 days if you did not do the fast track. So if you do it the normal, if it's not express, it takes 40 days or more or less, but just have it in mind around 40 days. And the cost of this DataFlow is around, for normal, is around 800 Saudi Riyal. For express, it should be around 1,000 plus. Okay, the express takes around 2 weeks to 3 weeks, maximum of 2 weeks plus. So after your DataFlow, the DataFlow group will issue you a report, DataFlow report, stating that all the documents that you've submitted are correct, and they will specify the dates you listed on those documents and everything. So mind you, for this verification, you will also need your international passport. Also, that will be your identity document. All right. So after this DataFlow, you move to the next step. This next step is done on the Saudi Commission for Health Specialty website. We also call it Mumaris Plus portal. So this Mumaris Plus is where you will do the next step of what we call classification. Now, for every profession, health profession, you need to be classified. After your verification with DataFlow, then you move to classification. So in this Mumaris Plus portal, that's Saudi Commission for Health Specialty website, you will create a profile. So this profile, you need to upload all the documents. These 3 documents that you verify with DataFlow, you need to upload everything there and also upload the DataFlow reports to back them up. Okay. All right. So after you've done this, then you will wait for a week or 2 weeks for them to classify you. So most of the time they have the data from your university or your country. They know what your country curriculum looks like and your experience, classify you under the rank you fall into. But the rank is actually yours to choose. Most times when you are applying for the classification, you have to choose the rank you want them to classify you under. So some people, they might not meet the specialist rank, and when you choose specialist, after going through your documents and your experience, they will reject your rank. Then sometimes you might choose consultant and you do not actually meet the rank of consultant level, they will reject your application. So if your application is being rejected when you choose specialist and you know that everything actually meets, but they kept rejecting your classification based on insufficient study, based on insufficient training or insufficient study, then you need to step below, you need to move to a lower rank. So once the rejection falls under insufficient study or rank, insufficient study or insufficient program, or insufficient experience, then you have to move to a lower rank. Okay, so that is how it works. So, but if you meet the rank qualifications or requirements, then they will rank you and approve your classification. So once they approve your classification, they will issue you an eligibility number. So with this number, you will use it to apply for your Saudi licensing exam, specifically for your profession. It is also known as Prometric exam. So this eligibility number lasts for 1 year, and you have 3 attempts to this exam. So once you write the exam and you pass the exam, then you move to the next step of registration. This is how it works. All right, see you next time. I will explain more in the part 2 of this video. Bye-bye.